So for today, we're going to learn about key practices in adoption and permanency, such as family engagement and initiatives to expand adoption efforts. And then we're also going to participate in a moderate conversation about practices and initiatives in adoption and permanency. So like I said, at the end, we'll have time for a Q&A. So if you have any questions, please feel free to send them through our QA function on Zoom. And that way will be how you guys can answer any questions that you guys have throughout the presentation. So first off, we're going to start with Cara Fox, who's the Heart Galleries of Texas coordinator. And Christopher, you can go to the next slide. Thank you, Cara.
Thank you. Good morning, everyone. I'm so happy to see all of you here. Thank you for taking the time out to do this. So as Cassandra mentioned, I'm Cara Fox with Heart Galleries of Texas, and we can go ahead and do the next slide. I'm here to tell you a little bit about Heart Galleries, and some of you may already be familiar. They've been around in Texas for a while, but we've got kind of a new approach that I'd love for all of you to hear about this morning. So what is a Heart Gallery? Some of you know what they are, but we provided some visuals here just so you can get a sense, because it's kind of a hard thing to imagine. But Heart Galleries are portrait exhibits that illuminate the spirit and individuality of children who want to be adopted. Next slide. So they are, as you can see here, they're portraits in public settings in a variety of locations. They can be in civic buildings and offices and airports and all sorts of places. But what they really are is a strength-based storytelling tool to help connect kids with prospective adoptive families. I think what I want to stress here is the portraits are designed to spark conversation, to tell the child's story, to have a way for people to really visualize and see the individuality of the child and learn more about what they need. And so part of how that is successful is that Heart Galleries also include very intentional community engagement and support for children in foster care, and also for adoptive families. So there's a piece of it that extends beyond the adoption, but because we know that there's still more work to be done after that. So next slide. Just to give you a little sense of Heart Gallery, Heart Galleries were started in 2001 by a foster adopt recruiter in New Mexico, and it's actually a national effort. There are more than 125 Heart Gallery chapters in 47 states. And it's interesting because they are very, very grassroots. And so the quality varies. They're very, very community-based. It tends to be a group of volunteers that learn about this as a storytelling opportunity and pull it together, and maybe they may offer it once and not again. It's, kind of hit or miss. And so one of the things we wanted to do here in Texas was take a more comprehensive approach to making sure that every child was able to be featured in a Heart Gallery. They've been anecdotally successful, but they're just inconsistent. And so we're looking for more consistency. Next slide. So why do we need a Heart Gallery? We have the Texas Adoption Resource Exchange, TARE, which is where children who are legally free for adoption in Texas are posted. But we know that caseworkers are busy and there's lots going on, and TARE photos really vary in terms of quality, how quickly they can get them up, the level of detail on the child that's provided, any sort of information on what kind of a family that child needs to be, matched successfully. And so statistics show that when we have a little bit more robust storytelling and strengths-based storytelling around the child, that Heart Galleries can increase adoption rates from less than 1% to over 60%. And I'm going to show you why that's the case in just a minute. Go ahead. Okay, so this is an example of a TARE profile, and these are profiles that are actually live right now. I pulled them last week. So this is Natalie. She loves sightseeing, learning, and socializing. Let's meet our next child, Quimoni. She loves dogs. So she is looking for a family that has a golden retriever. And then our last child, or young adult, youth, is Talon, who sounds fascinating, wants to learn about Germany and his own culture. Okay. So this is what, if someone was looking to adopt and they were looking on the on TARE, this is kind of what, this is typical of what they would see about the children on there. And I think we can all probably agree that our kids deserve to have their stories told better. There's way more to Quimoni than her love of dogs, right? And it's awesome that Talon wants to learn about Germany, but we know he wants to learn about other things too. So enter Heart Gallery. Next slide. Thankfully, the legislature agreed with us. Last legislative session, they allocated $12 million to support Heart Galleries of Texas expansion across the state and some funding to provide post-adopt services to support families after adoption, which is super exciting. Next slide. So we've got some great partners in this work. Several institutes at the University of Texas School of Social Work, Texas Center for Child and Family Studies, the Alliance of Children and Family Services, and the Governor's Commission for Women are all key partners in this initiative. So Heart Galleries are off and running. So, you know, as I mentioned, Heart Galleries did previously exist in Texas, in various regions of Texas, and typically pretty local, you know, to like one city or, you know, and kind of would come up for a bit and maybe go away or come up and be focused around a special event. And so what we are looking to do with expansion is make a more consistent presence in all DFPS 11 regions of the state. So last September, we down-granted funding to launch a Heart Gallery in all 11 regions in Texas. And so that means there will be one Heart Gallery for every region, but it will cover the entire region, all of the children in that region. So making sure that every child who would like to be featured can be featured. And then in August, we will grant the remainder of our funding to build out post-adopt collaboratives and services in every region. And I'm going to talk a little bit more about that later. Next slide. Okay, so right now what we're doing around that piece is regional collaborative building. And so identifying who are the partners in the community that are already doing great work. We're not trying to reinvent the wheel or duplicate efforts. And in fact, we want everyone that's doing the work to be talking to each other so that we can make sure that we make the best use of these precious resources. So right now, we're working with all of the communities to build those collaboratives and to conduct needs assessments to figure out where the funding is needed for post-adopt services. This summer, we'll release an RFA for bridge service and contracted organizations to tell us what their community needs in terms of post-adopt services. And then that money will come down and that will provide for ongoing community collaboration so that once families adopt, you know, there's a team of people that are working to build the support they need to help support that family and prevent adoption disruption. Next slide. Okay, so I mentioned before where we are. We're all across the state. These are our various Heart Galleries. And if you go to our Heart Gallery website, which Cassandra, if you can drop that in the chat, would be awesome. There's a little map and you can click on each region and get directly to each region's Heart Gallery. I will say this, some of them are still rolling their Heart Galleries out. They're still updating their websites and making sure that the photos that they have of the children are updated, because that's another thing that's really exciting about this initiative. You know, previously, a child might get their photo taken and it would not be updated regularly. And so you've got a child in the gallery that's been waiting to be adopted for 5 years. And the last photo we have is 3 years old. Under this initiative, every child will get their photo taken annually. So it'll be an updated photo that, you know, is featured in the gallery with updated interests, updated narrative. So as all of these galleries come online, you can click on each one of those and see. I think the ones that are online now, Heart Gallery of Central Texas is up, Heart Gallery of North Texas is up, Heart Gallery of Greater Houston is up, Heart Gallery of El Paso is up. So there are some that are live already that you can see if you'd like to go check those out. Next slide. So each region is launching a Heart Gallery website. Each region will make sure that child photos and strength-based narratives are updated annually, as I mentioned. Each regional Heart Gallery is going to be leading collaborative building for post-adopt services. So bringing together all of those people that are already doing the work and making sure that everyone knows about the funding that's coming down, helps identify what the needs are, that there's community consensus around what that community needs. And it's been so interesting already. Each of the Heart Galleries are so different. Each region is so different. And so what's super exciting about this project is that we have the flexibility for each region to build what it needs. We're not trying to make it consistent. We're trying to let communities build what they need. So that's great. So art galleries are also responsible for measuring community engagement and impact, and for building local sustainability for art galleries during the 2-year grant period. Next slide. Okay, so we want to go back to the real why, the youth, and why we are doing this. And I love these sweet faces, and I'm excited to show you what a art gallery can do for our kids. So let's meet them again in the art gallery. So first child is Tom. So you look at this, and it's so much more well-developed in terms of, I mean, we talk about why he wants to learn German and what his cultural background is, but also just learns a little bit about what he likes to do. He likes to read and play video games, and he's curious, and he wants a family that will be ready for that, that will nurture and participate in intellectual conversations, and get him out there and get him exposed to all those things in the world that he wants. He's looking for a bigger world and a family that will show him that. And so, I think when we look at this, we have a much better sense of who this child is and what kind of a family he needs. He just sounds so amazing. So that is him. Next young person. Okay, Natalie. So we learn here that she's super bubbly and chatty and outgoing. She loves school. She does need a wheelchair sometimes to get around, but she also loves PE as one of her favorite subjects. And so, she needs a family that is going to help her be active and do all of the things that she wants to do, and also just work within some of her physical constraints and help her reach some of her goals, her physical goals. So we get a better sense of what kind of a family she needs. Next slide. Quimoni. So I love this photo. It has so much sass. I feel like you can just look at it and get a sense of her personality and what an awesome kid she is. And she does want golden retrievers, yes, and that is important. But she also loves friends, and she loves connecting with people. She's a people person. She wants to be in a home with other children. She wants to, be in a space with them. She's willing to share a room. She's used to that kind of environment. She will need some educational support at school. Her parents definitely need to be patient. They need to be trauma informed. They need to be able to give her some one-on-one attention, and they need to be willing to help her keep her relationships with biological family members. So these are all, important things that families need to know when they're looking at, hey, am I the one that can meet the needs of this child? They need this additional background. Okay, next slide. So how you can help. I hope that you are as excited about art galleries as I am. And, again, I think the portrait is just the beginning, capturing the portrait, telling the story. I mean, there's so much community work that goes into this in terms of building the community collaborative and getting the art galleries in new spaces in the communities so that they reach more people and they spark more conversations. The photo is just the beginning. It's really about the collaborative and the unique needs of the community, and having people who understand the community doing this work with consistency. So you can help by talking about art gallery in your networks, increasing community awareness. If you work with the children, then you can make sure they're referred to art gallery as appropriate. They do need to come through TARE as a referral or through the SSCC, but sometimes there's a little bit of a lag with that. And so if you're a CASA, if you're a foster parent, if you're a judge, if you're whoever, when you have a child that's legally free for adoption, please make sure that you raise the issue of art gallery, or contact us directly. We can put you in touch with the region, and they can get in touch with the TARE worker in that region. So we'd love to hear about referrals. And then, another thing you can do is, in any community, if it springs to mind, a great location to host a art gallery that's high traffic, that has a lot of people coming through it, that has a lot of, potential families coming through it, reach out to your local art gallery. They are always looking for exhibits, or reach out to me personally and I'll connect you with your local art gallery. We're always looking for places to have exhibits. And this is a community effort, and everyone can play a little part of it. So thanks so much for taking the time to learn about art gallery. We appreciate it.
Thank you, Cara. And again, if you guys have any questions as you're listening to the presentations from Cara, Samantha, or Candice, please feel free to use the Q&A, and that way you can get those questions out there, and then we'll get them answered at the end. And then next, we're going to hear from Samantha Thompson, who is the TXPOP director. And so she's going to be talking to us today a little bit about TXPOP. So go ahead, Samantha.
Hi, everyone. I'm going to talk with you a little bit about TXPOP today. So first, I'm going to introduce some of the key aspects of our project, and then I want to spend a little bit of time talking more about the practice. Switch to that next slide, please. So these are our partners. The Texas Permanency Outcomes Project, or what we call TXPOP, is a 5-year federally funded project through the Children's Bureau with the goal of transforming Texas child welfare. We are currently in our last year of funding, and we have been implementing with different agencies across the state for the past couple of years, and we've learned a lot through that process. So early on, we developed partnerships with key child welfare stakeholders, and you see them listed here. Those include the Texas Department of Family and Protective Services, the Children's Commission, of course, the Children's Bureau, our funders, and our primary partner alongside us was the Alliance for Child and Family Services. So the Texas Permanency Outcomes Project refocuses practice, strengthens the workforce, and transforms how systems treat families within foster care. So this is our mission for our whole project. And then up next, you'll see our vision. Our real goal is to build shared power with children and families to reinvent foster care. So this project was imagined and developed based on what we've seen in our work with families and what current research is telling us. Everyone on the TXPOP team has prior experience working directly with children and families in child welfare. So what we were able to do is we were able to, on our project, have professionals who've worked directly with DFPS, who've worked therapeutically with families, or who've worked with families in other capacities. And through our work, through our previous work, what we have seen time and time again is that when authentic relationships between a child's natural connections are prioritized, this strengthens families and improves permanency outcomes for children in care. So we really thought about how we wanted to achieve the goals that we had. So we have a 3-pronged approach. The TXPOP practice model is one of the pieces of our project. I'm going to talk about that a little bit more in depth in just a moment. But through our statewide capacity building part of our project, we provided trainings and support to professionals working in child welfare with the opportunity to earn a professional certificate in child welfare from the Steve Hicks School of Social Work. So we were able to travel across the state to our different pilot site regions in 2, 6, and 11 and provide in-person trainings as well as online workshops that people could access for free. And then they were able to get a certificate through the Steve Hicks School of Social Work in child welfare. One of the other things we did as part of our statewide capacity building is that we developed a social marketing campaign called Compassionate Caregivers. The goal of this campaign is to humanize families and provide resources and support to everyone involved in a child's life so that connections can be preserved. So the Compassionate Caregivers social media campaign was really developed by an advisory group of actual caregivers. We had foster parents, we had birth parents, we had kinship caregivers, we had foster parents on that advisory group, and they were able to develop the messaging that they wanted others across the state to hear about family engagement and about how families and caregivers can develop relationships and maintain those relationships so that they can care for the children together. And then we had our system engagement. So TXPOP engages the system on the statewide and local levels by asking key stakeholders to meaningfully contribute to the work. So part of what we did is we implemented a statewide executive advisory group, and then we also developed local advisory groups in our pilot site regions. So that is our project as a whole, and now I'm going to talk with you a little bit more about our practice model. So this model encourages professionals to approach their work and interactions with others from a non-judgmental stance with the goal of sharing power with families. Through the use of various tools and trainings, ongoing case consultation, coaching, and online network of support, this model puts children's input at the center of decision-making and planning. It builds working partnerships between families and caregivers. It increases involvement of families in the day-to-day lives of their children while their children are in foster care. And it creates lasting safety and support networks around children and families. So one of the things that we did with our practice model is we trained case managers and child placing agencies as well as caseworkers with DFPS. And then in Region 2, we trained SSSC, permanency workers in the practice model. So we've trained those workers in Regions 2, 6, and 11. So far, we're actually holding our 13th training cohort right now, and we've reached over 300 child welfare professionals across the state and that have received our practice model training. One of the biggest, I think, things with our training that has made it the most successful is that it's not just a one-time training. So what we do is it's 12 hours of training that we hold over 4 different sessions. And then what we do is we meet weekly with each of our sites to talk about the practice, to talk about how they're using the tools. And then we also do case consultations. And I think one of the biggest successes of this practice model has been those case consultations. I actually just did a few of them yesterday and they went really, really well. And even regions that we have are no longer in right now, they're calling us for those case consultations. So those have been really, really helpful. We have a short video, just kind of like a 2-minute video that we're going to share with you about our practice model and our project. I don't know that we have the sound on that. Maybe it's coming up. Hang on just a second, it might be coming up.
I work primarily with families in the Brownsville Region 11 office. And so with that, we've had a number of opportunities to involve our parents with the TXPOP program. With the help of TXPOP, we were able to organize a meeting where children who are ambivalent about placement were put together to be able to talk about their thoughts and their feelings about placement. We incorporated the department as well as another child placing agency to talk about plans for these kiddos so that they might be able to continue to have visits with one another, even though they weren't going to be adopted together.
How TXPOP has benefited the families that we worked with at Monarch is that it's assisted us with reaching permanency quicker on some of the cases. And we've been able to collaborate with CPS where we're working together to have a successful outcome quicker for the family. What inspired you most about TXPOP?
With TXPOP, I felt like my opinion, my words, my conversation was being valued other than in the courtroom. Because in the courtroom, I felt like a second duck. But when I got to interact on how I feel and my opinions on how I feel about things, it made me feel, valued and, worthy to be able to be heard. Everyone wants to be heard, So that's why I connected with that program more better than being in court. I guess we both end up feeling like we both in the same role. We're just in different locations. We both were a part of my grandson's life. And we have to accept each other, for it's like a set of rules at her house, a set of rules at my house. Okay, I'm not going to interfere with her raising him, and she's not going to interfere with me raising him. We got to be respectful of each other because we got the same role.
Thank you, Christopher. So one of the things we do is, and who you saw in those videos, you saw Natasha Graves, who was previously one of our TXPOP site coordinators, and she's actually with the Texas Alliance of Child and Family Services now, helping us implement TXPOP. And then you saw a couple of people who have actually used the model and talk about what that was like for them. So I think that's important to share. So one of the things I wanted to share today is our values. So these are our values that you see here. I'm not going to go over all of them. I just wanted to introduce the values. And what we do through our training is that we really ground everyone in these values. So this is where we start our practice. We think about the values that we want to bring into our practice and how we want the work to look like on a day-to-day basis. And we know that child welfare work is complex. We know that it's complicated. And so the more we have these values that we can fall back on, the more that we're going to do good work. And then when we veer off of these values, we know where to come back to. So we really explore what these values mean to the different workers that we're working with in the training. The next thing I'm going to talk about is our strategies. So these are our 4 primary strategies for TXPOP. And so we have parent and caregiver involvement and collaboration, involving and informing children, engaging support networks, and family-centered planning. So what you saw in the video, I just want to connect some of this, that parent and caregiver involvement and collaboration, you heard Ms. Moses talk about that. So we connected 2 different kinship caregivers to plan out how they can co-care for the child together, because before that, they weren't even talking to each other. After we were able to implement network meetings, we were able to get them talking to the point where they were hugging each other after those network meetings. So Nakasha did really great work with that family. And then you saw Michael talk about involving and informing children, which is another important aspect of our project, where we're really wanting to be trauma informed. And we know that kids need to be informed of what's happening and what they can expect. And oftentimes that might get lost in the process, right? We're worried about their safety. We're worried about where they're going to be placed, but being intentional about informing them of what's going on and then involving them in the decision-making process. So with the family Michael talked about, we used the 3 houses to really connect with kiddos about a placement disruption that they experienced with their sibling. And through that and getting their perspective, we were able to better plan for their future and how being adopted doesn't mean that their relationship has to end. So we also have family-centered planning, where we're really focusing on the family's needs. It's not cookie cutter safety planning. It's family-centered planning, where we're really focusing our plans around the family and making sure that they have a plan that's going to work for them. And it's not about services that need to be completed. It's about the behavioral changes that need to be made. So those are our strategies. And again, we spend a lot of time in our training really talking about what those mean for the families that we're working with and what they mean to the workers that are going to implement this as well. So I'm going to spend just 1 minute talking about parent and caregiver involvement and collaboration. So TXPOP believes that children who are connected are protected. So the more connected a child is, the more protected they are. If we want better outcomes for children, we must partner with families. And one way to do this is by always involving parents. So in practice, this looks like ensuring parents are involved in parenting the child, meaning that they maintain the role of the parent by being involved in making day-to-day decisions about the care of their child. These might include medical decisions or educational decisions or otherwise. Building what's already working well with the family to keep the child safe, continuing family rituals and celebrations in the foster home and even in the adoptive home, right? We want to ask questions of when children are being adopted about, what are the things that you and your family celebrated? What are the things that are important to you that your kids keep celebrating and participating in? So asking parents what traditions are important to them. Another way we do this is involving caregivers, whether that's foster parents, kinship caregivers, extended family, or adoptive caregivers. So often they feel left out of the case planning and decision-making process for the children in their care, but we know that if they are meaningfully involved with the family and the case, parents are more likely to stay connected to their children and achieve reunification. So in practice, this looks like bringing the 2 families together to work towards the same goal of caring for the child and keeping the child safe. Asking caregivers to begin to think about their role differently and see themselves not just as the child's caregiver, but as a part of the child's whole naturally connected system. Working hand in hand with families to co-care for children. And we hope that caregivers can come to a place where they feel empathy for the family, understand that the child's family connections will always be important, no matter the permanency outcome, and distinguish between the reasons that brought the child into care versus value differences, which may include race and/or class differences. So that is parent and caregiver involvement and collaboration. One of the things we're going to mention real quick before we end is that we have tools. So I mentioned the 4 strategies to you. And what we do is we have 18 practice model tools. It doesn't mean we're going to use all 18 tools with every single family we work with. We really tailor the plans and we tailor with workers, what's going to be best for this family. And the tools are designed to help us achieve the practice model strategies. So I just spoke with you about parent and caregiver involvement and collaboration, and we have specific tools that workers can implement with families to achieve that. And we also think one of the unique things about our model is that we have tools to guide workers and how they can engage children as well, so that they can gain their perspective and share that with others. So this is really kind of the meat of our practice model, and a lot of what we consult on is the practice model tools. So that is what I have to share with you today about TXPOP. Just this one last slide here to keep relationships in mind, because really our model is based in relationships, not only relationships between families, but relationships between colleagues, relationships between leaders and those that they're leading, and relationships between workers and the families that they're working with. Thank you.
Thank you, Sam. I will also include your website information on the chat, and then at the end there'll be a slide with all of every presenter's email, so you'll also have that as well if you want to reach out to them individually. But next we're going to hear from Candice Dosman. She's the director of advocacy initiatives at Texas CASA, where she oversees the development and implementation of statewide advocacy approaches for the CASA network. So go ahead, Candice.
Thank you, Cassandra. Good morning, everybody. It's nice to see you. As Cassandra said, my name is Candice, and I'm at Texas CASA. Hopefully everybody knows what CASA is, Court-Appointed Special Advocates. We have a wonderful network of local programs across the state. There are 74 CASA programs in Texas that are all individual nonprofits that recruit and train CASA volunteers. So we need more CASA volunteers. If anyone's looking for a way to get involved, these volunteers are so important to advocate for the children that are in foster care. My main partners for CFE, Collaborative Family Engagement, that I'm going to be spending a few minutes this morning speaking to you about, are all of those CASA programs, all of their child protective service partners in their communities, and the SSCCs, the community-based care providers in those areas. So we are working basically with all the child welfare partners in Texas that are supporting the children that are in foster care. So Collaborative Family Engagement is run by Texas CASA in partnership with the department, which is why both of our logos are on this screen here. And we receive funding from the department to do CFE each year. So it's a true partnership. We train and work with the caseworkers, kinship workers, adoption workers at the department or the SSCCs, as well as staff and volunteers at the local programs. Next slide, please. So collaborative family engagement is really an approach that we're in our 9th year of implementation. We started in 2015. And it's truly a way, we're trying to actually change the system. We're trying to enhance CASA advocacy and enhance case practice by workers. So it used to, when it first started, it was kind of a program and something that people would make a referral to. We've moved over the last 9 years, in our 9th year now, like I mentioned, to really just be a part of case practice. This is the way that all children and families should be worked with if they're involved in the foster care system. You can see my Zoom background says CFE for all. That's really our motto. Every person that we're working with needs to be connected and worked with in this way. So I'll tell you a little bit more about that as we go. But through collaborative family engagement, it's a way for CASA and the Child Protective Service workers or the SSCC partners to really work together. This work of family engagement and connection that we've heard Cara talk about, we heard Sam talk about, it really takes a team-based approach, right? It shouldn't just fall on one person to do. That's why we're all here. The whole state wants to do this work of family engagement. We know how important it is. So we really focus on that collaboration. And we're modeling that. We're modeling that collaboration and team-based approach for the families and the young people that we're working with, right? They can't get through life alone. They need help. They need people And we need that as well in our day-to-day work. So we're modeling that team-based approach for the young people and families that we're working with. As I mentioned, we're doing this. The goals of CFE Collaborative Family Engagement are to enhance CASA advocacy and CPS case practice. We're really focused on building connections for young people who are involved in the foster care system, as well as their parents or caregivers. We use a bunch of tools you see on the side there, similar to what we heard with TXPOP with their 18-20 tools. In collaborative family engagement, we also use a bunch of different connection and engagement tools. There's about 30 of them now through one collaborative approach. And some of those tools are family meetings, and I'll talk more about that in a second. But we're using all of these tools to really increase the child and family voice in the case. So in the CPS case, making sure their voice is heard, listened to, and a part of all of the planning and decision-making that happens, because this is their life. It's not our life, right? They know what they need, and we want to make sure that that is heard in an authentic and meaningful way. We're doing the different things through CFE to really increase the number of supportive and non-paid people in the child's life. We know as professionals, whether we're a volunteer or a caseworker, that our time with that young person in foster care is time limited. It should have an end date to it. We will not be involved long-term. So who is going to be there after the CPS case closes? I love that Samantha said, connection equals protection. That's exactly it. We say services don't equate to safety. Connection is where that safety comes. So what we're looking at with CFE, I know this webinar is really about best practices and adoption and permanency, and I love that we were asked to be a part of this because we are really focused on connection, reunification, and permanency with family or fictive kin. So other people that are important to the young person or their family. Adoption might be a part of that, but my team and the work that we're doing is really focused, hopefully earlier on, before adoption is even necessary or on the table for this young person. We're wanting to get the children back with their parents whenever that is possible, as I know we all are working towards here on this webinar. Next slide, please. So our practice approach is called the 4 C's of CFE, and this is how we do it. This is how we do the connection and engagement work of collaborative family engagement. So the first C is collaborate, which I kind of mentioned earlier. This is CASA, the volunteers, the supervisors, working with their child protective partners, working with attorneys, therapists, whoever is working with the family. Along the whole life of the case, we have different tools and practices that they'll be using to talk about who do we know of now, who could we be working to connect this child and family with, what tools are we going to use, when are the next family meetings, really working together to involve the family along the life of the case so that, again, it doesn't just fall on the CASA volunteer to make these decisions. They're working with the whole team. CFE is based in Kevin Campbell's family finding model, for those of you that are familiar with that. And that original model has evolved over the last decade, but it used to be really searching for people and spend a lot of time looking for 40 family members. And that moves into our cultivate, which is our second C. So cultivate is the use of tools to really engage with family and connections and maybe find them if necessary. But what we've learned from that original family finding model and work is that we don't need to spend a lot of time searching for people. We need to just engage with the people we know of in a different and better way, and search only when necessary. So a lot of the tools we use in Cultivate, which is doing things to really bring those folks to light. We can involve them in the family meetings, all of those things. They're focused more on connection and engagement versus searching. So we really only search when necessary. But we're cultivating. We're looking for those family and fictive kin, the important people to the children and their parents, really to try to get them to a family meeting, which is the third C of convene. So we've worked hard over the last 9 years to really embed this into practice so that it's not something different. It's not another process that families have to go through. It's not another program that they're hearing about. It's not another meeting anybody has to go to. We've integrated it into CASA advocacy and CPS case practice. That's better for everybody. Nobody needs any more meetings. We have model and initiative fatigue, right? We want this to work in the work that we're doing. And Texas has a really great family meeting practice. And so we've really tapped into that. And we have some different philosophies and practices that can be used in those family meetings to make them truly family meetings. I've been to lots of meetings that were called family meetings that were just the professionals. And we checked our box and said that was a family meeting. So we have different things in place that really make those meetings meaningful for the family, where they feel safe and that they can best participate. But that's where the real work happens of collaborative family engagement. We get to see that network, those connections, those folks important to the young people and parents come and be a part of the process in the family meetings, which is the convene. And then, of course, the fourth C is connect. We're doing all of this, the collaboration, the cultivation, the convening, to build those connections for the young people and their parents. CFE is not just for children. We definitely want kids to be connected while they're in foster care and after, but we're also doing this simultaneously for the parents. They need their support network as well to best take care of the child when the child is able to go home. So that's our 4 C's, which is the practice approach. On the next slide, I think I wanted to just show a few real quick examples that are recent of the connections that were able to happen that resulted in permanency. So I won't read those on the screen, and these will be sent out after. But we know that these family members exist, right? Everybody has family, everybody has connections. It's a matter of really welcoming them into the situation, into the table, to let them be involved. We don't need to control who is involved. We want to support that to happen in a way that's meaningful for the young person. Our next slide shows our growth of CFE. I mentioned that we started in 2015. It was the fall of 2015 in just 3 local CASA programs and their CPS partners, which is on the far left of the slide. All the way up to fiscal year 23 last year, we were in 72 of the CASA programs and their CPS or SSCC with their SSCC partners. This year, well, I'll show that in just one second. But so we've had pretty, significant growth each year. The children served has grown each year. The families served with this approach have grown each year. But we haven't yet reached my background of CFE for all, right? We do know every child that's in foster care has experienced some separation or removal, and they need that connection. So we continue to grow, and my team continues to really focus on supporting the CASA programs and their partners to do this work with all children in foster care and that all children that CASA is appointed to. On our next slide, it shows where we currently are and what we're currently up to. So I'm pleased to say that it's taken about 9 years, but the entire CASA network, 74 CASA programs are involved in family engagement and connection-informed work. 73 of those, 74 are doing it through collaborative family engagement. We're in almost 200 counties of the 254, so we're getting there. We're in all the DFPS regions and working with the 4 providers that were live at that time and all the ones that are going live tomorrow, maybe, or very soon. So we continue to really try to, stress that this becomes a part of our CASA advocacy, our case practice approach. I have a wonderful team of 5 coaches that are regionally located on this map. So I'm in Austin, but as we've also heard our other presenters share, these approaches really are individualized for the communities. CFE looks different in all of these 194 counties because every county operates different. Your courts are different. CPS operates differently there. So we've really tailored this so that it can work specifically for those communities and counties, because it needs to be community-based, right? That is where the children and families are. Every family is unique. So CFE does look a little bit differently everywhere, but my team of coaches works really hard across the state to support implementation of CFE. So that's what I wanted to share with you this morning. Opportunities to get involved are, we have offerings, statewide training offerings throughout the year. We can share that with you if anyone would like to come. We are always looking for more CASA volunteers. We're always looking for more people to be connected to the young people and their parents. So I thank you all for being here and for the great work that you're doing.
Thank you so much, Candice. And so I've also on the chat included the website for the collaborative family engagement. If y'all want to check that out, you have the links there. And like I said, we'll also send an email afterwards with all of these links. And these are our presenters. So again, thank you so much to Cara, to Samantha, and to Candice for all that wonderful information that you all shared. So this is a time for the Q&A. I'm not sure if anybody has any questions. We did get one question on the that was submitted, and it's to Samantha, and she said, Kathy wants to know if the TXPOP training will be available to Region 10.
Yes, so because our federal funds are coming to an end this year, this is our last federally funded year, we are working with the Texas Alliance for Child and Family Services to develop a sustainability plan. So we're currently working on that. And the goal of the sustainability plan is to make the practice model accessible across the state. So I would say if you're interested in the practice model, you can reach out to me and I will get you connected with our partners at the Texas Alliance of Child and Family Services.
Perfect.
Thank you for that question.
Yeah, thank you. And I don't see any other questions, but I do have a question just listening to you all as you presented on these like innovative practices. And so it sounded like you all are working on enhancing or building on a system that's already been created. So I'm just wondering, and it also feels like everybody's sort of in different like trajectories in their project in terms of like length or like how long they've been doing this. But I'm just curious about like any challenges that might have come up for you all in terms of like implementing these new innovative practices. And then we're all here, you know, as child welfare professionals in various different roles. So just curious of like, how can we help with those challenges or barriers that you might have come across?
Sure, I can answer that real quick. Privatization of the foster care system has been a challenge for us because we did start in 2015 when I think just it was starting to happen in Region 3 with OCOK. And so we've just had a lot of turnover in the workforce. And so training of that workforce has been a challenge because it's continuously something that needs to be happening. And so, I mean, it's also a great opportunity, and we're excited about, you know, all the great work that's happening with the SSCCs, but the actual carryover of the work and the training of staff has been one of our barriers.
Thank you.
I can also share just a little bit. I think that one of the simple ways that everyone on this call can help is, you know, there's always a challenge within child welfare about how we talk about families, how we talk about children, the words that we use, the categories that we put things in. And so one simple thing we can all do that might shift the way things are happening is just to be really mindful about how we talk about families. So I want to go back to our values, right? To making sure that we're practicing and coming from a place of humility, that we're really wanting to listen more than we're talking. And we're really wanting to get to know the families as a way of working with them instead of as a way to kind of control what's happening within the family. And so that's just a simple way, kind of going back to those values and thinking about what those mean for you.
So one of the things that I think is exciting about all of these initiatives is that they kind of build on each other, right? I mean, I think we're coming at it with a similar philosophy, which is collaboration, community engagement, kids first, best interest of kids, and building communities that can support all families. And so I know for Heart Galleries, we're super excited to be leveraging, work that TXPOP has already done and working with that team in terms of sharing the trainings and engaging the community. And so I think it's exciting that it's all kind of can converge and can be not a duplication of efforts, but each thing building on top of each other for families.
Perfect. Thank you all so much. Again, thank you, Cara. Thank you, Samantha. Thank you, Candice, for taking your time. And thank you to everyone that showed up today. This is our first webinar for the Heart of Galleries of Texas on innovative adoption practices. And we really hope that you can join us for more webinars and trainings. We have a monthly webinar, and then we also have trainings during the next few months for child welfare professionals. So everybody here and caregivers as well. We really want to collaborate and work with everybody for our families here in Texas. And so I'll be putting, so I put on the chat for our webinars, and then I also put on the chat, I'm going to put on the chat how to access our trainings. And so please, if y'all have any questions, please feel free to reach out to us. And like I said, we will send you all an email later with all of these links as well. But thank you all so much for joining us, and we hope you have a good rest of your day. So thank you all. Bye.